Hello, my name is Brenda Martinez, and I am a graduate student in the Master's Program of Speech Language Pathology in Albizu University. Today, I will be discussing several compensatory strategies that can be used for swallowing more safely. It is important to know that some of these strategies can be dangerous to some individuals, so you should only do these strategies if they are instructed by your speech language pathologist. So the first strategy that I would like to discuss is the chin down or chin tuck. So this is usually beneficial for patients with delayed swallow reflexes. And what it does is that it widens the vallecula and narrows airway, pushes epiglottis and tongue-based posterior. So I will demonstrate with some water. The next strategy I would like to discuss is the head rotation or head turn. This can be done to the right or to the left. So usually this prevents tracheal aspiration when the pharynx is paralyzed. It closes off the weak side and airway protection. An example of this would be for a patient who has right vocal fold paralysis. So now I will demonstrate. The next strategy I would like to discuss is the head tilt. So this is usually used for patients who present with unilateral oral or pharyngeal dysfunction. And what it does is help direct the bolus to the stronger side. And now I will demonstrate. And then now I will be discussing some positions that can also help with swallowing more safely. The first one is the recline position. Usually what this does is help reduce pharyngeal contraction or reduce laryngeal elevation. Head and neck cancer patients benefit from reclined positions who have difficulty propelling the bolus back. And the front of the oral cavity is raised and the back is lowered. Since the force of gravity makes it easier to bring a food bolus from the oral cavity to the throat, this method is often used with patients who have difficulty sending a food bolus into the pharynx. Reclined positions are usually used on patients who have severe dysphagia. And another position that's also beneficial is side lying or recumbent position. And for side lying, tilting the body to the non-parallel side makes it easier for the force of gravity to bring a food bolus downward and pass through the non-paralyzed side. The recumbent position in the non-paralyzed side is downward, and it allows the bolus to pass through the non-paralyzed side. In general, patients with relatively minor symptoms use a side lying position, and patients with more serious symptoms use a recumbent position. And then also, it's very common for all of these positions to be used together. And I hope you enjoyed watching, and thank you.